We all get pain from time to time. And let's be honest, your imagination can run wild with what that pain could be. That's why we've been revealing possible reasons behind your weird pains. The pain we're talking about today is one I'm all too familiar with. It's pain in the back, right? It radiates to the jaw. You can actually feel it in the shoulder as well. Sharon felt this pain. Take a listen.
I felt this pain. It's like a just like a bolting pain that went across my lower back. And the pain just radiated through my whole back. And it was hurting at an intensity level of a 10, definitely straight to a 10. And I couldn't understand what was going on. I got myself to urgent care. I'm glad that I did not ignore those back pains and just leave it as so, because once I arrived to the hospital and they checked me out, they told me I had a heart attack.
Wow. So what happened?
I woke up that morning and decided I'm going to get something to eat for dinner. And I went and was taking meat out of my deep freezer. And when I bent over and I stood up, I felt this pain that just, it hit me in my lower back, really hard. And it went down my leg and it went up to my back, and my body, it felt like I was having back spasms. I've had back spasms before, so I identified it with that immediately. And then I called my chiropractor and I was telling him, and I had him on speakerphone, and he was giving me some things to do. It just didn't work. And he said, you should hang up and call 911. Smart
move by that chiropractor. So you get to the hospital, you got this back pain, which a lot of viewers right now are thinking, geez, I have back pain too. But this is back pain in your upper back, to be clear.
Yes.
You show up in the ER, what do they do?
When I got to urgent care, they checked me out and EKG, and it said that the numbers were wrong and they needed to call 911. So I went from urgent care to the hospital. When I got to the hospital, they did an exam. I think they did an x-ray or whatever have you, and came back, was like, you're not having back pains. And then a chiropractor came to visit me, who was my current cardiologist, came to visit me, and he told me, he said, so guess what, you've earned 5 days with us. And I said, 5 days for what? What are you talking about? I'm on the morphine, back pains, and he says, well, you had a heart attack. I said, I had a heart attack? Yes, he said I had a heart attack. And once I got that information, I was completely blown away with the fact that back spasms and a heart attack, but I had to remove the back spasms out of my mind and understand that, and I was told that women, experience different pains.
Amen.
Before a heart attack.
You should send flowers to that urgent center. They saved your life. And send some to the chiropractor as well. So how are you doing today, and why do you want to come talk about this?
Today I'm doing great.
Thank goodness.
Thank you. Thank you so much. And I've been inspired and encouraged by not only your show, but the American Heart Association, the Association of Black Cardiologists, the information that's given to us women about heart disease and what the different matters are about heart disease, that watching your show and finding out that you are a cardiologist and you do a lot of health talk, that it encouraged me to start my own foundation. And it's called the Heart Speaks Foundation. And we speak to you about heart disease, and especially for women, because we overlook it. We go with everything else. I called my girlfriend and I was talking to her about the pain I was having.
While your heart's screaming to you, help me, because that's what the pain is, right? Your heart's
Yes.
saying, come help me. Okay, thank you very much. I appreciate it.
Thank you so much, Dr.
When you think
Ross.
of pain associated with the heart attack, your brain usually goes to your chest, right? People think they're going to get like an elephant sitting on their chest. Women are actually more likely to experience heart attack pain in the back and the jaw than men. So what you're saying is life-saving, because people are going to open their eyes and minds now to this possibility. Joining me now is my good friend, cardiologist, Dr. Mark Eisenberg. He's at Columbia with me, and ER doctor, Dr. Samson Davis, another good friend, just across the river in Newark. Dr. Eisenberg, back pain. Why does it happen there when you have a heart attack?
Okay, so it turns out when our bodies are being developed, the same nerves that supply the heart also supply the back, the jaw, the arm, the stomach. So it can be a little confusing to the brain. It's actually called referred pain.
It's like they short circuit. You've got wires that are touching that, you don't want them to touch, but they touch it, the way you're made.
Yeah.
And we are all made differently, so our wires cross in different ways. Dr. Davis, how common of a complaint is upper back pain with heart patients?
It's really not that common, actually. It's more atypical. Usually with true heart pain, we see the chest pressure in both men and women. It usually radiates to the shoulder or down the arms. But you can have atypical symptoms as the patient did with upper back pain or lower back pain. So you want to make sure, especially if you have risk factors.
So we got to wake up to the realities that pain can come in many different ways. How would you treat a patient who came to you saying they had back pain and they're not sure what caused it, but you were suspecting it might be the heart?
Yeah, you start with history. So if they have risk factors, high blood pressure, diabetes, then an EKG, which is electrocardiogram, we see if there's any activity that's abnormal in that EKG. So the history of EKG, blood work, we check a blood level called troponin, which is specific for the heart itself. So if there's heart damage, that troponin ideally would be elevated. Then there's the stress test, and obviously the golden sort of standard to make sure is catheterization. We see if there's any blockage in the vessel.
So it's not a mystery. It's a knowable reality. So if you're having chest pain, you don't have to suffer because you don't know whether it's a heart attack or not. It's relatively straightforward to figure it out. What are the telltale signs, Dr. Eisenberg, would accompany a heart attack?
Okay, so that's a great question. So in the majority of people, they do have chest symptoms, but usually there are other symptoms associated with it, like shortness of breath. You could feel dizzy. Sometimes you feel your heart fluttering, sometimes nausea and vomiting. So definitely with the chest pain, it could radiate to the back or to the arm, to the neck.
So let me underline what my colleagues are saying. I want you to go through the signs of a heart attack in your own mind so you don't miss them. So chest discomfort, pain in the upper back, neck, or jaw can happen. Shortness of breath, the most important sign, because it means the blood's backing up in your lungs. You got to get to that in a timely fashion. And you can also get lightheadedness and nausea, and you break out in cold sweat. And you might be thinking, well, other problems can cause those symptoms as well. Well, you're right. Do you know how to tell the difference between chest pain from a heart attack and chest pain from an anxiety attack? Because they can look the same. I'll reveal what you need to know. That's next. Today's show is a reminder to never, ever ignore weird pains, especially when it could be a sign that your heart is in trouble. Now, one of the reasons you may not go to the ER when you're having chest pain is because you think it's just an anxiety attack. That's why I want to teach you the difference between the two. Cardiologist Dr. Mark Eisenberg and ER Dr. Samson Davis are both back. And there are 5 things I want you to pay attention to if you think you're having chest pain that might be severe and significant. The first is the location of the pain. Dr. Davis, how can you differentiate between anxiety attack and heart attack?
Well, it's tough. It's very difficult. But anxiety attack, you feel more of a sharp pain. It's kind of localized, whereas a true heart attack, you feel this pressure. You feel like something is sitting on your chest like an elephant. It may radiate to your jaw, down your arm. So it's a difference in sort of the kind of symptomatology. You may have shortness of breath as well.
Why is the pain in different locations, Dr. Eisenberg?
Well, it's more like it's different quality of pains. With a heart attack, the vessel leading up to the wall of the heart is getting constricted or closed off. And so the muscle's not getting enough oxygen and acid could build up. So it's sort of an inner pain. It's sort of a pressure or a pain that sort of can radiate all throughout the inside of you. With the chest pain, with the anxiety attack, a lot of times it's the outer muscles that are sort of hurting. So that's why it could be sharp or reproducible. You could touch it and it can sometimes even get worse.
Because you're breathing fast,
Yeah.
You're making things worse just from the fact that you're having a panic attack, which
Exactly.
again, it's a severe problem. It's not just in your head. Your body will actually feel it. Next point, you got to pay attention to what the pain specifically feels like. So Dr. Davis, how do you differentiate in the ER when someone's sitting in front of you?
So yeah, like for instance, we see this brick here. So this is somewhat the chest pain or the chest pressure from a heart attack. You feel that brick sort of kind of laying on your chest. Whereas the anxiety, you feel more of a sharp, like knife-like pain. So you feel this kind of sudden onset of the pain. You might feel like a feeling of doom. You may get like a feeling in your throat where you feel like you just can't get a deep breath. Not that you're short of breath, you just feel like I can't get in enough oxygen. Yeah. And usually that's more of a panic attack.
Why is that pain different as well, Dr. Eisenberg?
Well, again, when you're having the anxiety pain, you're breathing very heavily. So you're using a lot of your outer muscles. So a lot of times it actually gets worse when you breathe in, gets better when you relax, worse when you breathe in. So it usually is because of the muscles.
And when you understand what's causing the different problems, it makes sense that your symptoms are different. Next thing you got to ask yourself is, how did the pain come on? Why is it so important, Dr. Eisenberg?
Well, a lot of times heart attack pain, like with Sharon, it happened while she was exerting herself. She was running around her house. So a lot of times with heart attack pain, you're shoveling snow or you're doing some exertion and it comes on sort of pretty quickly. With anxiety pain, you could sort of just be doing nothing and all of a sudden feel like doom, and so you start getting very anxious, and so it comes on at different times.
You also have a clue by figuring out how long that pain lasts. Yeah. Right? So, Dr. Davis, why is that a question you'll always ask your patients?
Yeah, because with anxiety, again, is that precipitant. It's something that's causing this sort of feeling of doom and gloom. And so it usually subsides. It comes on at a very high peak and it sort of subsides and plateaus. Whereas this chest pressure, heart attack pain, it's a crescendo effect. It keeps building and building and building, and you can't get comfortable. You're short of breath. So it's more of a sort of progression of pain versus the panic attack.
Why is this is again, I'm just going back to the specific issue. The pain with anxiety attack gets better because I guess you stop breathing quickly and you let the oxygen back into the muscles. Why does the pain keep getting worse with the heart?
Well, because with the heart, you're losing oxygen to the muscle of the heart, and it's not going away, so it starts to get worse and worse and worse, and acid builds up, so it doesn't go away. In fact, with heart attack pain, a lot of times it starts to get not only worse, but you'll feel it more with shortness of breath when you walk around the apartment or the house. With pain with anxiety, it does start to subside when you start relaxing.
And I want to leave the last word to you. There's one symptom, which I did not even know about till today, that you argue is very helpful in practical world rules. This actually makes a huge difference figuring out differentiating heart attack from anxiety attack. It is?
Exactly, numbness and tingling in your fingers. So it turns out when you're anxious and you hyperventilate, you're breathing out too much carbon dioxide. So that's actually making your acid level in your blood less. And it turns out this less acid level in your blood causes a little bit of constriction to the vessels leading up to your fingers. So you can feel this tingling and numbness. Also, it can lead some constriction to the vessels leading up to your head, making you feel dizzy and want to black out.
So you can actually make yourself black out with an anxiety attack?
Exactly.
Oh my goodness.
That's why breathing in a bag is helpful when you're having an anxiety attack, because you're breathing back the carbon dioxide level that you've been breathing out.
Yeah.
So it makes the blood level back to normal.
These are great practical insights. That's why I like talking to doctors who are frontline folks who are actually doing the work. God bless you both. Now that you know the signs of a heart attack and a heart emergency, visit DrOz.com for life-saving tips on what you should do if someone near you has one.